And when we talk about changing priorities in America, we are going to end the international embarrassment of the United States being the only major country on earth not to guarantee health care to all people as a human right. So let me thank the National Nurses United for their support. Let me thank the American College of Physicians for understanding that Medicare for all is the solution. Today in America, we pay twice as much per person for health care as do the people of Canada or any other major country on earth. We're spending $11,000 for every man, woman, and child. And yet, despite that huge expenditure, 87 million of us are uninsured or underinsured. And because of the greed and corruption of the pharmaceutical industry, we pay by far the highest prices in the world for prescription drugs. In America today, 30,000 of us die each year because we don't get to a doctor when we should, because we're uninsured. And unbelievably, think about this, 500,000 people go bankrupt every year because of medically related debt. An American should not go bankrupt because he or she is dealing with cancer or heart disease or Alzheimer's. And while so many of our people are uninsured or underinsured, the healthcare industry last year made $100 billion in profit. I believe, and you believe, that the function of a rational and humane healthcare system is to guarantee healthcare to all of our people. Not to make huge profits for the drug companies and the insurance companies. Just the other day, in a major medical publication, some researchers from Yale University pointed out in a major article that Medicare for all will save us $450 billion a year and save 61,000 lives. For over 100 years, from the time when Teddy Roosevelt was president, to FDR, to Harry Truman, to JFK, to Lyndon Johnson, to Jimmy Carter, to Richard Nixon, to Barack Obama, presidents have been talking about universal health care. Well, the time for talk is over. Let's pass it. So whether the healthcare industry likes it or not, we will pass a Medicare for all single-payer program.
This isn't some game. People die every year in America due to lack of coverage, and the estimates are staggering. It is estimated that upwards of 45,000 people in America die per year due to lack of coverage. But notice how I said in America. because there are a lot of countries that already guarantee healthcare to all of their people as a right, and thus their people do not lose their lives due to lack of health coverage. That seems like the morally right thing to do, does it not? To make sure one's people are healthy and well? And yet, we here in America do not do that. And as a result, as aforementioned, we lose a lot of people per year due to lack of coverage. Moreover, a less broached aspect of the healthcare debate is that a lot of people go bankrupt due to medical expenses, which would not be a thing if we joined the many countries around the world and guaranteed healthcare to all of our people as a right. In truth, if we did, nobody would go bankrupt because everybody would be covered. You know, it is just beyond unbelievable to me, the greed of the drug companies and the health insurance companies in this country. Now, the media and seemingly most of our politicians in Washington make it seem as if the idea of guaranteeing healthcare to all of our people as a right is some radical idea, and that it would cost too much. But don't be fooled. Medicare for All, the universal healthcare plan Bernie Sanders introduced, would reportedly save we the American people a ton of money. So, in short, Bernie's Medicare for All bill would guarantee healthcare to all, significantly reduce the amount of money we spend as a country on healthcare, and save the many people we lose per year due to lack of coverage. It's honestly a no-brainer.